Welcome to Staying Connected, a podcast where I talk to people about their stories with VEDS, Marfan, Loeys-Dietz, and related vascular and aortic connective tissue conditions. The views, information, and opinions in this podcast are those of the individuals involved, and the information presented does not constitute medical or other professional advice or services. Welcome back. Today we're going to talk to Hugh Cox, a member of the Vascular Ehlers-Danlos Syndrome, or VEDS, community, diagnosed just in 2022. He was first misdiagnosed with a clotting disorder. Before we get into the interview with Hugh, if you like this show and you want to help our communities raise awareness of VEDS, Marfan, and Loeys-Dietz, you can now buy merch, including tote bags and t-shirts, with new designs coming soon. A link to the store is in the episode show notes. You can also support the show by joining my Patreon. It's a fantastic way to support the podcast, and the show wouldn't be possible without the continued support of my subscribers there. If you've already been supporting the show, thank you. Let's get into the interview. Hey, Hugh, thank you so much for coming onto the show to share your story with Vascular Ehlers-Danlos Syndrome. Do you want to introduce yourself to people who don't know you yet?
Hi, Katie. It's just nice to meet you, be on the podcast. My name is Hugh Cox. I live in South Carolina with my wife and 3 kids. And I have vascular EDS.
And when were you diagnosed with vascular EDS?
I was diagnosed back in 2022, a couple years ago, almost just right about this time 2 years ago. And I guess my story really started for me back in 2011. So I kind of leading up to the time, it was the spring of 2011. The start of that year, I had been playing with the kids outside, and they were sledding down a hill. We had snow, which is really rare in these parts. And trouble was, there was a little fence at the bottom of their yard, so we'd slide and catch them. This time, both kids took off at the same time, and I reached out to catch them. And when I caught one of them, I felt my bicep sort of pop. And so just all of a sudden really just felt sick, just had a lot of pain from that, went and laid down. Didn't think too much of it. I went to an ortho guy the next week to kind of see, because I was like, something feels a little off. It just doesn't feel like it's strained. I felt something. And so they said, sure enough, you've had like a tendon tear, and so we need to repair that. And so I got on the schedule for surgery like a week or 2 later, and I was all set for that. And then right at the beginning of March, which was, I believe, on a Monday evening, we just got the kids down for bed. It was at kind of after dinner, and I all of a sudden just felt the most severe kind of left flank pain, and doubled over. I had to go to the bathroom, just threw up. Like, I just was like sort of immediate. I was like, what in the world hit me? And I just laid down trying to get in a comfortable position, but just couldn't. And my wife came in, and we said, well, better go to the emergency room to get that checked out. Our first thought, only thing we knew that sort of caused that type of pain was sort of a kidney stone or something. So I said, I must have a kidney stone or something along those lines. So we got coverage for the kids, and then she and I went to the hospital that evening. And turns out the hospital was very busy on that evening, and we ended up sort of waiting in the waiting room a lot. I was laying on the floor because it hurt quite a bit, and I just, could not get comfortable. That was like the biggest thing at that point in time. And got triaged after probably a few hours, and they sent me back for a CT scan, and the CT scan came back clear. So they said it was a CT without contrast. And so at the time they said, okay, looks like you don't have a kidney stone. We'll send you home with some painkillers. By this point, it was like basically, I think the sun was almost coming up at this point. So I headed home, and I was working kind of a high stress job. So then I went to work, and I worked through that day, which was probably not the smartest thing. And then the next day, so that was a Tuesday, the Wednesday, I woke up and I'm like, something's not right. I'm just not feeling well. So I went to my primary care that day, kind of got worked in with him. And, so I was running like a low grade fever, and my blood pressure was slightly elevated. At that point, the pain had kind of dissipated some. It was kind of there, but not to the same extent. And, he's like, something again just doesn't feel right. He's like, I'm going to send you back out for another CT. It's a different hospital, one of the sort of smaller satellite around the main city where we live. And he's like, we'll do this with contrast. We'll kind of see what's going on. So all this is new to me. I hadn't really had CT scans much or anything like that. So I went over to the hospital. It was kind of late afternoon, and got in, had the CT scan, got my stuff, I left. And as I was pulling out of the hospital, he gives me a call, and he says, where are you right now? And I said, I was just leaving the hospital. He's like, is there a pharmacy nearby? And I said, yeah, there's like a pharmacy right on the corner here across the street from the hospital. He says, I want you to go over and get a baby aspirin, and then I want you to head straight back to the emergency room. They'll be waiting for you. And so he's like, you have a blockage in your left renal artery, and it looks like a clot. And so they're going to be kind of prepared to take you in because you need to get that addressed. And so sure enough, I went to that hospital. Basically, they just took a lot of vitals and stuff, and then I got transported to our main hospital. And so we live around the Charlotte, North Carolina area, so I went to one of the main hospitals here in Charlotte. So, and from there, it was, again, more imaging, but at this point, it had been long enough that for a clot, they weren't going to really do anything other than give me sort of blood thinners, and then the pain started coming back quite a bit during that stage. And so it was really kind of blood thinners and pain management at that point.
Yeah.
And so, yeah. So that was my first event. I was in the hospital for about a week, and they were just, trying to kind of get me stabilized with the pain. I will say that left renal artery block is so painful. And I don't know, it was one of those things I could never get comfortable. Even they would try to give me oral medication, and that really wouldn't cut through the pain at all. That did nothing to dull it. IV, I believe Dilaudid was what I was on. That kind of toned it down just a touch, where I could kind of lay and somewhat sleep occasionally. But still, it was just, it was not good.
Yeah.
And so.
Relatable.
Yes, I know.
Very relatable. So that's 2011, and you're in the hospital with this renal artery blockage or clot, and you're getting blood thinners. So then what? So
they were trying to figure out at the time, why would I clot? So the real key thing that everybody thought was that there's a blood clot, and why is this young guy, I was 36 at the time, why is this young guy having a blood clot to his left renal artery? It just didn't make sense. The other imaging didn't show any other things like that at the time. And so, they were testing for various clotting disorders at that point to try to figure out, okay, what can we attribute this to? At the time, they thought that my left kidney was still functioning. And so my blood pressure was becoming more and more elevated, but they weren't treating it aggressively because I think that they were trying to preserve that kidney and not really overly stress it. So I left the hospital on some initial blood pressure meds and warfarin at the time, or Coumadin, and was said, see your primary care. We'll follow up. We'll visit the nephrologist, that sort of thing. We'll try to work with the kidney and figure out what's going on. So that's what happened. I left the hospital, and it was a rare clotting thing, and that lasted for me for about a month, and then the next shoe fell for me.
Oh my gosh. What did this feel like at 36?
For me, it was a real shock. It was I've been very active. And, all of a sudden to have something like this, major medical, in the hospital for a week, it just really, it was hard to process. Sort of active, like the exercise, that sort of thing. That was just part of what I would do, growing up, and that's what my wife and I would do. And so it was a little bit of a shock to be in that place where, all of a sudden you're on this medication, you're taking blood pressure meds. It's like, I'd gone to the doctor for physicals and all, but that was about it. Like that was the extent of it, maybe once a year, just trying to stay up with her health and sort of stuff. But, this was very strange. And then just knowing what I was supposed to do and not do. And that was, under the assumption that I had a clotting disorder, like it could maybe happen again. So that was also disconcerting for me as well.
Oh yeah, for sure. Man, I'm stuck on this clotting disorder, but, what was the next shoe that dropped? You said it wasn't long, right?
Yeah. So over the next few weeks, so since it was a clotting disorder, my primary kind of point person was a hematologist, and she was actually great. Like she really followed up and kind of helped me coordinate and understand things, just navigating the medical system, because that was new to me as well. And so, I went to see rheumatology, I went to see nephrology. There's a number of folks I went to see specialist-wise over the next month or two, all the while, getting my blood checked every week just to make sure my coumadin levels were at the right place, that was still therapeutic. And that was a whole different thing, because it was like things which you could or couldn't eat at the time. And the one thing that I was checking pretty regularly was my blood pressure, because that was one thing that they had advised me to check. And it was running quite high. I was running typically like 180 over 120. And one time I go to the rheumatologist's office, they check me in the office, and it's like 220 over 120. And they were really concerned. They're like wondering, like, do we send you out to the ER? Like, do we need to get this down? Like, and I'm like, I'm not too concerned. It's been like 180 over whatever. So like, and so they weren't really buying that, but they said, well, if it comes down while you're here, we'll let you go. And, so it dropped to about my new normal range at the time.
And that was since your renal blockage.
Since my renal blockage during that month or so after.
Mm-hmm.
And so they had started me on some new blood pressure meds, and just gradually kind of inching up, the dosage to try to bring it down kind of slowly, without introducing too many things at once. Because I had not been on any blood pressure, any medication like that before. And I believe it was during this time too that I had a scan to check my kidney function. And toward the end there, like after several weeks, maybe a month or so, they determined that left kidney was not functioning. So then they got more aggressive on the blood pressure medication at that point, to a certain extent. So gradually increasing. But sort of the next big thing for me was that next month, my wife and I went to a dinner with my in-laws. And during dinner, my hand started feeling a little strange. And I have sort of that Raynaud's syndrome where I get the cold fingers and my fingers turn white. And so I was somewhat used to that. I didn't know really what it was called at that point, but I had that sensation, but I was like, this is different, because I'm looking at my hand and then I can't move my middle fingers. And so that was different. That had never happened before. And so I go to the bathroom, try to warm my hands up, and I still can't move my fingers. And so I go tell my wife, I'm like, hey, I think we might need to go, because like this is not feeling right. So we get back home, and I gradually get the movement back in my fingers after a little bit. But then the back of my tongue starts going numb. And I was like, this is so weird. Is this like a blood pressure medication side effect? Like very naively, like this is not supposed to be happening. And I'm thinking, just chalking it up to some sort of like random thing that's happening for me. And I go to sleep, wake up the next morning. I think that was a Saturday night. Wake up the next morning. I'm sort of back to normal, and continue on with that weekend. And I get home that Sunday night, and then Monday morning late morning, I think I spoke with my hematologist and told her, hey, I was having these weird symptoms, like, is this supposed to be happening? And she got all concerned right away. And she's like, hey, I want you to pack yourself a bag and I want you to go back to the main hospital. And again, they'll be waiting for you. And so I go back in. She's like, it sounds like you have a blockage on your, perhaps a carotid artery, or something's being blocked and you're not getting blood flow there. And so I go back in, I get new scans, and they do see a blockage on my right carotid artery. And it was, I believe, if I remember correctly, about 90% occluded. So it was almost no flow through it at the point when they imaged it.
So then those symptoms were like stroke symptoms?
Yeah, like a TIA. Mm-hmm. So like stroke symptoms of when it probably was blocked. So again, we're working under the premise that it's a clotting disorder. And they said, oh no, he clotted while he was on the Coumadin. That really got them worried. So they're like, sometimes that can happen. And so now we're like, okay, now we're really concerned.
Knowing what we know now, that is so scary.
I know. And I was like crazily concerned, but like, all right, now I've like got this thing where I can clot at any moment, and the therapy's not working for me. So given the carotid artery dissection, or at the time blockage, what they thought, they bumped up the blood pressure medication. So I went home on more than I came into the hospital with.
For blood pressure and for blood thinner?
And blood thinner. But since they were worried about the Coumadin not working, they showed me how to do Loeys-Dietz shots. So I had my Loeys-Dietz needles, and I would inject into my abdomen area every 12 hours. So in the morning and in the evening. And that was what I left the hospital with, for an indeterminate amount of time to be on those shots.
That is just wild. So that's all 2011.
So to kind of round out 2011, I went to see a clot specialist up at UNC Chapel Hill. And he, took a really deep look at my case and everything. And he said, there's some question in your scans, like, was it a clot or was it a dissection for your carotid artery? He's like, we really need to know that. Because if it was a clot, that's one thing. But if it was a dissection, then you may not have clotted on the Coumadin. So that therapy may have actually been working, and it was something else entirely, maybe due to the blood pressure or something like that. So I went back and got better imaging done on the carotid arteries, and they determined that it was, in fact, it looked like just a dissection, no clot there. And during the course of that imaging, they also had realized that both carotid arteries had dissected. I don't know if it was at the same time, but I've had both carotid arteries dissect.
So by the end of 2011, you have a bicep tendon tear, and you've had a left renal artery, quote, blockage, and bilateral carotid artery dissections.
Correct.
But you don't get your diagnosis for years later. So, how did they figure this out?
So over the years, I, just for the sake of the clots and everything, or the clots, I still call them clots sometimes because that's kind of what I was talked about all along. But I would get fairly routine imaging, at least. Over the next few years, I got regular imaging for the carotids and my renal artery. They actually had done, at that same time, they had done all sorts of scans to try to make sure there were no other clots at the point, like vein and artery studies in my legs and all sorts of things, all throughout. But I would occasionally hear someone say, hey, your case just sounds unusual or something. I wonder if it might be like a connective tissue type disorder. And to me, I didn't know much about connective tissue disorders, but nobody ever sort of followed up on that. It wasn't something that was pursued until I got a new primary care. And so I got a new primary care physician in 2021, I believe. Yeah, 2021. So he went through my case pretty thoroughly, like really sat down with me. And he's like, I think you should get tested for a genetic, rerun the genetic testing, both for clotting disorders and for connective tissue disorder. And
had you been tested before, or was this like the first time run?
I had been tested for some clotting disorders, but nothing for connective tissue disorders.
Got it.
And so this was the first time. And so it took about, it took a number of months just to get on the geneticist calendar. So it was, I don't know, at least 6 months after that I got to see, I got the appointment and went to see the geneticist. And so that was 2022. And it was interesting. So I go in there, and it's funny because the genetics is at like the children's wing of the hospital, or the children's side. So I'm sitting in the waiting room and all the cartoons are playing, and I go into the waiting room, there's the princesses on the wall and everything. So it's just a really unique setting. It's like, this is what I would be doing with my kids, not like typically for me. But so, she does the whole exam and, like checks my feet, checks everything. And she's at the end of it, they're going to collect the blood to do the actual blood testing. But, she did just the exam, and she's like, I think I know what you have. I have an idea what you have, but I won't tell you unless you, specifically want me to tell you. Otherwise it might be something just kind of worry you until we get the genetic test back. So, or to get the results back. And so I said, all right, don't worry me. I'll wait for the results to come back. And so that's how I left it. So she had an idea of what she thought it was, and I was just going to wait for the results. My problem was I tend to look at the visit summary, and I didn't realize that she put it in the visit summary. Mm. So I was, sitting, I think at lunchtime at work or something, and I pulled it up, looking at the visit summary, and I was like, there's something on vascular Ehlers-Danlos she's put in her notes that I might have. And so, of course, I do the Google search to see what this thing all is. And that really hit me. That was kind of like a much bigger hit than what I was expecting.
Yeah. What was the information that you found first? Do you remember?
So, first off, as I read every bit of the description, I'm like, oh no, this makes way too much sense. Like, everything starts to fall into place when I started to read it. I'm like, just even some of the smaller kind of characteristics, I was like, this looks so much like me. It's just really eerie to have it described that way, because nothing else had up to that point. And I think the biggest thing that sort of really hit me the hardest was just, the life expectancy of 48 years old. Because my next birthday was about 3 months out, and I was going to be 48. Mm. And I work with numbers, I work with life expectancies, I work with all that sort of stuff. And I know what those numbers are, and I know how they're calculated. I know all that. It's still, when you realize that there's a stat out there that says, hey, by this point, that sort of mean life expectancy, that's a lot younger than I was expecting. And so that piece was just I think it was harder to process. It brought it back into a different kind of reality, living under the idea that, for basically 11 years, a clotting disorder, there was no necessary time frame on that. It was just an oddity, something I lived with on blood thinners, and that was life. And this sort of put it into a whole different perspective. There were a lot more risks that would be out there. So yeah, it was a much weightier realization at that point.
For sure.
And I pretty much knew how the tests were going to come back at that point.
So let's talk about that. What were the things that were kind of, you said like characteristic things that you saw yourself in? I love that word eerie. That was a very relatable word, like this feeling, like reading about yourself. What were those things? Like, why did you know it was going to come back positive?
Like things like the translucent skin on your chest, like that was me. Things, I don't know if it was specific, but I've had a number of like smaller muscle sprains, tears over the years that just seem to happen to me. I have sort of the flat feet. I have some of the Raynaud's. It's just some of the characteristics that I was seeing. Like those things were like, oh, okay, that makes sense. Then the dissections, and then that sort of stuff was probably not even a blockage, or maybe it's some type of a clot, but it was probably not necessarily associated with, just a random clotting disorder. This was something associated with a vascular event. And so those pieces started to make a lot of sense to me. And I was like, oh, yeah, I can check a lot of the boxes, probably even ones I'm not even remembering now. But like this list, like I can check off almost everything on it. So I was like, that's...
So you had Googled it or looked it up while you were waiting. How long after that did you have to wait for your results?
I don't know if it was a couple of weeks or so. I can't remember exactly. I feel like it was a couple of weeks, and then once the results came back, then I had a follow-up appointment with the geneticist to kind of walk me through it. But of course, like anytime I get something like that, my mind goes into research mode, and I just like basically cram to learn everything I can about it.
Like you're going to take a test on it.
Yeah, I'm kind of that way. So it tends to be, if I get really interested in something, it tends to, there's a lot of focus I can put on it in a short amount of time.
So how did you handle this news? Not only medically, like I'm sure the whole path of anticoagulants was abandoned, but like, I don't know. I mean, you go from having this rare unknown clotting disorder, and you're on sounds like a really decent sized dose of clotting medications. And then you find out that, oh no, your arteries actually probably tore, and that clotting medicine is like definitely maybe a little riskier than we thought it was. And you're looking at the life expectancy, and you're coming up on your 48th birthday. And I just want to put a little plug in there for the 48 number. I know if you're listening to this podcast and you're like, oh my gosh, the number is 48. It's not 48 anymore. So don't throw out that number. If you're listening to this, don't have a panic attack. 48 is an old reported number, and it's reported as a median. And it's often misreported and misquoted as an average, but it's actually a median. Just in general, we need updated research on that. But for you, how did you move through this period of time?
Yeah, for me, it was kind of a flood of, a flood of emotion, a flood of just how do I process this? And when I mean process, it's just the realization that you have something different than what you thought you did. I was pretty comfortable with the other diagnosis. The other diagnosis was thought to be a one-off. This is genetic. So all of a sudden I've got upstream and downstream considerations of what it might mean, both for my, parents and kids. So that all of a sudden came into play. And then just the medications and therapies I was on. I had, at the highest point, I think I was typically on 5 different blood pressure meds to keep everything stable at a steady state. So for the longest time, for many years, I was on 5 different medications, as well as the aspirin. And I had switched on quite a few years back from the Coumadin because it was just harder to manage. I switched to Xarelto. So I was on Xarelto, and I was on aspirin, and I was on 5 different blood pressure medications. And I gradually weaned some of the blood pressure meds off, like maybe down to 3 or 4, kind of depending on what therapy was. But yeah, you're right. It was, and then there's also the considerations for, okay, what activities are okay or not to do. Like in the recent, probably year and a half leading up to the diagnosis, we as a family had been taking martial arts classes, and we'd kind of signed up for that during COVID. Of course, I tore like a little bit of an inner thigh muscle, and of course, I was like having some things of that, but like you could see, like all of that sort of stuff was now like the exercise recommendations and all that. Martial arts was not in there. Breaking out of like chokeholds and stuff was not in there. And so like, that was like, oh man, that was probably pretty risky. Doing the sparring where they punch you even with the pads on, probably not a good thing. So it was, I think it was just a lot like to go through to figure out how to redo the meds. And honestly, it was tricky getting off. Like, cause I'd been on the Xarelto so long, I had to, it took me a while to get off it because nobody wanted to make the call to take me off. One specialty would refer me to the other specialty, would refer me to the other, and it would kind of be circular until, sort of my managing cardiologist kind of got on the phone and said, okay, we got to figure out what this looks like. Like we kind of need to make a call for that. But eventually I came off the Xarelto. I'm on the baby aspirin still, but yeah. So got that sorted. But then I think the next big thing was like, the genetic testing for my immediate family to see what that looked like.
So are you the first in your family?
No. So my dad was my only living parent. My mom had passed away from breast cancer back in 1999, so quite a number of years back. But we had him tested. He was 88 at the time, and we also had I have 3 kids, and we had my 3 kids tested as well. So it turns out he turned out positive for it, and 2 out of my 3 kids as well. And so for the age-wise, it was pretty amazing. Like, he was 88 at the time, went to see the geneticist. He was getting pretty elderly, like macular degeneration, typical old age stuff. And probably didn't know all the reasons we were there, but, they saw him, they were really good with him and everything. And so he got his diagnosis as well. So that's where I don't know if he was the first or not. We don't have any real clear records earlier than him. But, and then he, like late last summer, his health really started to decline, and he actually passed away last fall at 89. But really from old age and not from anything VEDS related.
Yeah. Did he have like a complex medical life before his diagnosis, or did that explain anything, or was it just kind of like whoa, that's strange?
As far as we know, he had not really had any of the complications, anything like I've had. At the time, given his age, he'd had a number of imaging type things done. He'd had like a heart stent put in at one point. He had a pacemaker installed. Probably the only thing that was sort of unusual in his case was when they were putting in the pacemaker, somehow the lung on the opposite side collapsed. So he had a pneumothorax on kind of the opposite side from where they were working. And it was a little strange at the time, and they weren't quite sure. So that perhaps his sensitivity to that may have had a role in that. Yeah. He had other types of medical things, but not anything vascular in the same way. Nothing that would have pointed to any like complex medical history with respect to like really vascular, heart disease and things like that. But other than that, it was pretty standard.
Yeah. Do you know what kind of mutation that you have?
Glycine substitution, I just can't remember at the moment what was the substitution for. Yeah. So it was...
Definitely need more research on this. And, I know that we were talking earlier about kind of difference in presentation sometimes between generations, and what does that mean? I think there's just so much more research to do in this area of, what do these mutations do? Like, what is the significance of one versus the other in a lived life, I'm curious what it felt like. Like, did it change your perception of vascular EDS and like your perception of your own, for lack of a better word, like potential prognosis when you found out your dad was positive?
I think it really did. It did for me. It creates a weird state of mind for me. And let me see if I can describe it. It's with his prognosis, like of his long life, you're like, oh, there's, given immediate family, there's a good chance like you could have a similar type of life. You could, be able to age well like he did. And then on the flip side, I know I've had multiple events that he never had. And I know that there's no guarantees. There's no guarantees in life, but there's no guarantees, especially in VEDS. It's kind of the randomness that catches, I think, everybody off guard, especially when you hear of something happening. And for me, the challenge is just like some days it feels like that age that you're going to live to just comes really rushing back close in. And sometimes it seems really far out. And I've always thought of it myself as like, and I kind of suspect a lot of people have this thought, is that there's sort of an age at which they don't picture themselves existing, but up until that age they can. And for me, it's been kind of a really almost like mind-bending thing, because it's like that age just goes zipping back and forth between something old and something like really near. And trying to figure out, like a lot of times you'll see articles about longevity and doing things that'll help you live a long, healthy life. And you're like, is it worth putting my time into that? Like, perhaps I only have a very short time and I should just super maximize what I have. And then again, I look at him and I'm like, oh, it's way out there in the future. And maybe I should really pay attention to doing those things that perhaps could enhance, life out 10, 20, 30 years. And that's been hard. That's been a hard, it may just be me and the way my brain works, but that's been a hard thing to sort of come to terms with. Because on any one day, it can feel like it's close. And then on another day, it can feel like it's really distant. And that time when you don't picture yourself existing in this world. So
yeah, I feel like that is, I wouldn't be surprised if a lot of people experience that similar feeling that you're describing. Because over here, the one other person with vascular EDS in this conversation, I'm over here like nodding. Yes, I definitely feel that. And I would not be surprised if a lot of people listening, I felt when you were describing it, it felt like you just like hit the nail on the head there with such a major challenge of dealing with this diagnosis and so much uncertainty. There's just spontaneity and uncertainty everywhere you look with vascular EDS. And sometimes it doesn't feel like there's any rhyme or reason. And you're like, just like you described, like sometimes I imagine, seeing my grandkid grow up. And sometimes I'm like, oh, I'm not going to see him grow up. Like, it's just back and forth. And it changes based on all sorts of things. So you were diagnosed not very long ago. It was 2022. And I know that you've met people in the community. How soon did you get hooked in to like meeting people with this? Like how fast did that happen and what did that feel like?
I think it was probably a few months after my diagnosis. My wife did a lot of research as well. I'm not on Facebook, but she is. And so she found different, connection points and kind of ended up in some spots. And the Marfan Foundation, I think we sort of stumbled on that as far as a resource and realizing that there are some support groups. And so I think the fall of that year, 2022, I guess, I probably kind of got connected with some of those groups. And honestly, that was really helpful, just hearing people and hearing their stories, having somebody that, like, as you're going through this stuff, you're like, oh, okay, I can sort of relate to that. And as I've been in the groups, it's nice because you don't have to explain everything and they get it. And, most of the time it's hard to explain to people the full weight. They can't absorb it. I don't think it's a challenge to understand, to sort of put yourself in that place, to sort of mentally imagine what that would truly feel like. And I feel like members of the community don't, like, they know. Everybody has their own unique experience, but they know what their experience is. And there's sort of a shared undercurrent there, a shared theme that, you look at them, you can nod and, like, you can, be having, like, a bad day with it mentally even, and just understand, hey, like, I don't have to explain to this person.
Yeah. Yeah. I'm so glad that you got connected with community so quickly. Meet people. I think you're in North Carolina, so I think there's a handful of people there in Raleigh. Or no, you're in South Carolina, right?
So I'm right on the border between North and South Carolina. So yeah, like, we went to the Raleigh walk this past spring, and that was really cool to see folks. I went to both last year and this year the New York walk. My oldest daughter and I went to the New York walk last year, and then I took all 3 kids to the New York walk this year. So my sister lives close in to the city, and so it was just cool to be able to go visit her, and she came in too, and we all did it together. So
that's so awesome.
It's really neat.
So you've had a good deal of lived experience between both the period of time it took to get this diagnosis right and the medical things that you've been through. And do you have any advice that you would give somebody else who has gone through that long diagnosis period, or that, I would almost say misdiagnosis period, because it wasn't like you were undiagnosed. You weren't waiting for a diagnosis of vascular EDS. You were just misdiagnosed with something completely different. Do you have any advice for somebody that went through or is going through something like that, or is trying to navigate that situation? Or I guess they wouldn't know that they're navigating that situation until they get the correct diagnosis. So
it's a challenge because I wasn't looking for it, and it honestly just kind of hit me out of left field. Like, it was just unexpected. But I would say I myself would probably keep pulling on loose threads if I had thought that there was something there that was not getting adequately answered. I think that there's more opportunities these days to get connected or find someone who you can work with in the medical community to sort of get you to the right place. Just from, like, I was thinking, even so, for 2 out of my 3 kids have VEDS as well. And just, stepping through the process with them of getting the right medical team in place, getting the right, getting them plugged into the right spot it's been a challenge. And it's a whole different challenge than me plugging into the right spot. Like, and, if they have any type of symptoms, knowing how to manage those and treat those. Like, those are all challenges that are different when you're dealing with somebody else. And that's one of the things that, like I found particularly challenging, and I could totally sympathize with people who are like the parent of someone who's in the role, and you're trying to find out for you and for your kid, like what that looks like. And sometimes it's honestly you just keep pushing and pushing and pushing until you can get something that you're comfortable with, finding out either the answer, getting something resolved. I found that a lot of times a seeming roadblock isn't always one. There's usually some other way to navigate around it. If you can find the right person or connect with the right, individual or place or people, I think it makes a big difference.
Just keep trying.
Yeah. Because I think you need to sort of, for my own sake, I can only speak from that, but I would want to get it resolved because I don't like that sort of unsettled feeling if it's sitting out there. Because for one, with something like VEDS, you really don't know how best to navigate it unless you know for sure. Like if you know yes, or you know no, then you can make that determination. But when you're sort of sitting on the fence, it's really hard to sort of what if, it's you're playing the what if game on two sides of it without actual, data to make the decision on.
For sure. And if there's a medical professional or a medical student listening to this podcast, what do you want them to take away from this, from your story, or learn from it?
I would say be really curious, especially when a case presents strangely that doesn't seem to fit the normal patterns. I think I've had so many people say that, oh, your case looked, it's odd, like everything, but it kind of like just ended there with the odd. I didn't know enough to pursue it further. And then from my initial visit to the hospital, if somebody presents with flank pain, just do the contrast with it just to make sure. Like they were just checking for a kidney stone for me, and that didn't show, what was really going on. So I know that's very specific, but like that is the thing I would say.
Hey, that flank pain is no joke. With those infarctions, they're horrible.
It was like the worst pain I've ever had. Like I can't even adequately remember what it was like. Only I think when I heard you describe it on something recently that happened to you, while you were describing it, I could relive it to a small extent. And I was like, oh my goodness, I can't imagine. Like it's unique.
It is. It's very unique. One of the ER docs was like, well, it's kidney infarctions and renal dissections are very rare. So it's most likely a stone. And I was like, it's an infarction, but let's find out. This is not a stone. Oh, I feel for you. And I hope that someone listening to this takes that away because, I feel grateful that, I had the team in place and I had my diagnosis and they knew to do a CTA or a CT with contrast or whatever, and they knew what they were looking for. But, that's not always the case, as you point out. And I love that advice, really. I think you just never know. And how many people think they have a kidney stone and get sent home from the hospital without a scan that would look at the arteries? That's just such a good point, and I'm glad that you brought it up.
Mm-hmm.
Yeah. Well, thanks so much for coming onto the show and sharing your story. And it's been really great getting to know you. And of course, I've got to meet you a couple times in person too. And that's been wonderful. You have a wonderful family. And thanks so much.
Well, thank you, Katie. I appreciate your podcast. That was one of the things that for me was really helpful, especially in the beginning, was just learning about other people, their stories. It's so relatable. And you can feel so isolated without it. So I really appreciate the work you do, and keep it up. Thank you.
Thank you. Thanks for listening to this episode featuring Hugh Cox, sharing his story with VEDS. Next week, we'll talk to Nancy Billen, who has a variant of unknown significance, or VUS, on the gene associated with VEDS. If you're ready to meet others, get involved, or need support, there are links for you in the episode show notes, as well as information on how to sign up for the VEDS Collaborative, a research study for people with VEDS, Marfan, and Loeys-Dietz. If you like this show, be sure to share it on social media or give it a rating or review. You can also support the production of this podcast by joining my Patreon or by buying merch. As always, my top tier patrons are listed in the episode show notes. If you want to be on the next season of this show, there's a link in the episode show notes to get in the pre-interview calendar. I'll be starting the interview process for next season in September. See you soon!